It's 1811. You're strapped to a wooden table in a crowded room, and the men holding you down are strangers. There is no anesthesia. No one on earth has invented it yet. The surgeon rolls up his sleeves, picks up a knife still dark from the last patient, and leans over you. He tells you the only thing that can save your life. Hold still. This will be fast. Then he begins, and you feel every second of it. For almost the entire history of our species, this was medicine. Not a nightmare, not a rare horror, the ordinary price of staying alive.
A quick warning before we go further. This story is graphic, and every word of it is true.
And how our ancestors lived through the unsurvivable and the stranger horror that took the place of the pain is the part that almost nobody tells you. We know it was real because some of them wrote it down. In that same year, 1811, a writer named Fanny Burney underwent surgery in Paris to remove a tumor from her chest, fully awake, with nothing but a glass of wine cordial to steady her. She lived, and later she described it. She wrote that the moment the steel entered her, she began to scream, and that she did not stop for the entire length of the operation. She could feel the blade scraping against the bone. She stayed conscious through all of it, and when it was finally over, the memory was so unbearable that for months she could not speak of it without reliving the whole thing. That was not a botched procedure. That was surgery working exactly as intended. So here's the first thing we tend to get wrong about this world. We imagine the pain itself was the enemy. It wasn't. The real enemy was the clock. A conscious body can only take so much before it fails. The shock, the blood loss, a heart that simply stops from the sheer terror of it. So a surgeon in that age wasn't judged on how gentle he was or how careful. He was judged on one thing above all: speed. The faster the blade, the better your chances. Mercy, back then, was measured in seconds. There were attempts to soften it, of course. Opium, if you could get it. Alcohol, until you were senseless. A leather strap or a musket ball to bite down on, which is exactly where the phrase, "bite the bullet," comes from. But none of it reached deep enough. You went into that room, and some part of you stayed awake for all of it. Which raises a strange question. If speed was the only real mercy, exactly how fast could a human being cut? Fast enough to become a legend. In the operating theatres of London, there was a surgeon named Robert Liston, known as the fastest knife in the West End. He could take a leg off at the hip in under 30 seconds, sometimes closer to 25, moving so fast that the watching students swore that if you blinked, you'd miss the entire amputation. He clamped the blade between his teeth to keep both hands free, and the whole room learned to trust that blur of motion, because that blur was the line between living and dying. But that same surgeon is remembered for something darker. The story goes that in one single operation, he managed to kill 3 people at once. 1 amputation, 3 deaths. Now, you should hear that as legend rather than hard fact. Historians are fairly sure the tale has grown taller with every retelling. But hold on to that number anyway, because how 3 people could possibly die from one man's knife tells you everything about the true killer of this era, and it was never the blade. If the hidden half of our own history keeps catching you off guard like this, take a second to subscribe. Pulling out the parts of the human story that got quietly left behind is the entire reason this channel exists. And you'll want to stay, because this is where the story turns, and where you find out what was really hunting down every patient who was lucky enough to survive the table. So picture it. You've survived the knife, the limb is gone, the wound is bound, and against every odd you are still breathing. You'd assume the worst is behind you. It isn't, because a second killer is waiting, and it doesn't live on the operating table at all. It lives in the ward. In those hospitals, no one yet understood infection. Surgeons operated in coats that were stiff and black with the dried blood of old operations, and they wore that filth as a badge of honor, proof of how many patients had passed under their hands. They would go straight from examining a corpse to cutting into a living person without ever washing. Pus seeping from a wound was thought to be a healthy sign, a sign the body was mending. And so a patient who had endured the unthinkable, who had survived the screaming and the blade, would quietly die 3 days later of a fever that no one could name. And that is the answer to our 3 deaths. The patient died of infection. The assistant, whose fingers were clipped by that flying blade, died as well. And the third, a spectator, is said to have collapsed on the spot from sheer fright. Whether or not that last piece is true, the truth buried under the legend is very real. In this age, the operation itself was almost never what killed you. The room was. And then, on a single morning, all of it changed. The 16th of October, 1846, in the surgical theater at Massachusetts General Hospital, a room still remembered today as the Ether Dome, packed with skeptical men who had come expecting to watch a trick fall apart. At the center stood a dentist named William Morton, holding a glass globe filled with ether vapor. The patient breathed it in and slipped away somewhere no patient had ever been. Not asleep, not fainted, simply gone from the pain. The surgeon, John Collins Warren, cut into his neck, and the patient did not scream. He did not thrash. He felt nothing at all. When it was done, Warren turned to the silent, staring room and told them plainly that this was no humbug. For the first time in the whole story of our species, a human being had slept in peace through their own surgery. Sit with what that actually meant. Every ancestor who came before that morning, every last one who ever needed a blade, had to be awake for it. And then, in a single quiet moment, that entire inheritance of pain, thousands of years deep, simply came to an end. Except here's the twist that none of them saw coming. Ending the pain, at first, made everything worse. Think about why. When surgery meant unbearable agony and a desperate race against the clock, surgeons only ever cut when there was no other option left, and they got in and out as fast as humanly possible. Take the pain away, and suddenly they had all the time in the world. So they operated more often. They cut deeper. They attempted procedures no one would have dreamed of before. And every one of those new, bold, unhurried operations opened the body wider to that second killer still waiting in the ward. For a while, painless surgery didn't save more lives. It cost more of them. Because our species had conquered the pain long before it understood the poison. That final reckoning came from a surgeon named Joseph Lister, who noticed something simple, that wounds shielded from the open air and hands and instruments cleaned with carbolic acid stopped those mysterious fevers. Only when both halves of the puzzle were solved, the pain and the infection, did the operating room finally become a place you walked out of far more often than you were carried. So when we look back now at that person strapped to the table in 1811, the astonishing thing isn't that they endured it, it's that they chose it at all. They knew the odds. They knew about the ward. They knew the sound that room made. And still, over and over, our ancestors climbed onto that table and reached for the one thin chance that they might get to live a little longer. That's the part worth holding on to. Not that we could survive so much pain, but that the hope of a few more years was always, somehow, worth the knife. Which leaves you with one honest question, and we genuinely want to know how you'd answer it. If you had been born into that world, no anesthesia, no cure, would you have taken the knife awake? Or would you have taken your chances with the disease? Tell us in the comments.